All right, sorry everyone. I think we may have had some technical difficulties, so we're going to start over. My name is Nada Harik. I'm one of the infectious diseases doctors here at Children's National, and welcome to this Facebook Live event where I'm hoping to answer some general questions and give some general advice about COVID-19, and then get to some questions from folks who are viewing online now. We also got some great questions already from folks out in the community when this event was advertised. So I've got those written down and I'll definitely address those questions as well. So I know everyone out there has a lot of concern about COVID-19, and so I thought we'd start with just some general information about coronaviruses. So as you all have probably heard now from the news, coronaviruses are a large family of viruses, and they are known to cause many different illnesses, ranging just from the common cold to potentially more severe diseases. A novel or new coronavirus is when we have a new coronavirus that has not been previously identified. So in late 2019 of this last year, a cluster of individuals with pneumonia was noted in China, and very quickly the pneumonia was noted to be caused by a new or novel coronavirus. So the disease that caused that illness was called coronavirus disease 2019, which is abbreviated COVID-19. And the virus that's actually causing coronavirus disease 2019 or COVID-19 is been named SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. So the virus that's causing COVID-19 disease is not the same as coronaviruses that commonly circulate among individuals in our community and typically cause mild illnesses like the common cold. This is a new a virus that, since we haven't seen it before, is infecting a lot of people as they do not have immunity to that virus. So I thought I'd start with just some general advice or information about COVID-19. For the vast majority of people, the immediate risk of getting exposed to the virus that causes COVID-19 here in the United States is thought to be low. Right now, there is only a few communities in the United States where we are worried about widespread circulation. So overall, in the United States, again, I want to stress that right now the risk is low. Although things with this virus are changing daily. So I'm going to refer a lot in our talk today to information that's available on the CDC website. That's also available on our Children's National website. And through the Children's National website, we also have links to the CDC. I definitely would recommend that people go to those sites because that's going to be the most up-to-minute information as we're learning so much more about this virus even by the hour. I think one important thing to keep in mind right now is that most people that have COVID-19 are not going to get very sick. So from confirmed cases, and we have some really great data out of China with a very large percentage of confirmed cases, we know that about 80 to 85% of people only have a mild or moderate illness with COVID-19. That typically occurs about 2 to 14 days after they've been exposed to the virus. Fever, cough, shortness of breath, body aches, fatigue are some of the main symptoms that we see. URI symptoms may be more common in children. Again, we're learning a lot more about symptoms among different age groups as we're learning more about this virus and getting new data. Certainly, there have been infections reported in children, including in very young children. But so far, children don't seem to be significantly affected by COVID-19. Right now, children that have confirmed COVID-19 have presented with more mild symptoms, although there can be some severe complications, but those appear to be very uncommon. I do want to report from that great data that we have out of China that only 2% of the COVID-19 cases overall have been in people less than 20 years of age. So a very small minority. And again, remember that those were cases that had very mild symptoms. However, I think it's really important for us to keep sick children away from grandparents. As we know, older people are more at risk for having severe infection, and also people of all ages that have underlying health conditions that can put them at risk for becoming more sick with this disease, since they're more vulnerable populations. Children may actually be spreading this disease even though they're not that sick. So I'm going to give some general kind of recommendations for all people, not just for children, about what we can do to kind of help reduce our risk. So number one is to avoid work and public areas if you are sick. And that includes even mild cold symptoms, because right now that may be how COVID-19 is affecting children. So stay at home if you're not feeling well. We give that advice to everyone. We take it here in the hospital as well. Other important advice is to always cover your cough and your sneeze. So we talk about great cough etiquette or hygiene. So try to, when you cough or sneeze, use a Kleenex or a tissue to capture your cough or sneeze. If you don't have one handy, we want you to cough or sneeze into your elbow. But that's really an important way to help mitigate spread of this infection. Washing hands, I can't spread that enough or emphasize that enough. It seems very basic, but it's one of the most important things that helps us in terms of prevention of diseases. So wash your hands, do it thoroughly and frequently. Use soap and warm water, and do it for at least 20 seconds. There's lots of fantastic videos that you can find online on the CDC website and other places that show really good techniques for how to wash your hands. And then there are certain times we really do want to wash our hands well with soap and water. So before, during, and after preparing food, before we sit down to eat food, before or after we're caring for somebody who's ill, who's been sick or vomiting or had diarrhea, certainly before, after changing diapers for babies, after using the toilet ourselves, after blowing our nose or sneezing or coughing like we talked about, after touching garbage. Those are times where we really want to actually use soap or water. If you're not, it's not available to wash your hands with soap and water, you can use a hand sanitizer. We recommend one that has at least 60% alcohol, and those are certainly important to use when hand washing resources are not available. I want to talk a little bit about what you should do if you think you are exposed to someone who has COVID-19, or if you yourself think that you have COVID-19. So we want to encourage people to talk to their primary care providers. And we recommend, first of all, contacting your primary care provider by telephone if you're not extremely ill. Avoid going to the emergency department unless you're truly experiencing an emergency. Also avoid going to your healthcare provider's office without calling, again, unless it's a very severe or you're experiencing an emergency. We need to do these actions to really help limit the spread of virus in our community, as well as to allow our healthcare providers in the community, our emergency departments, to care for individuals who are the most ill first. So I want to just kind of make that general announcement. Okay, so some questions that we got already that I wanted to address, and I'll kind of go through these, are how is the virus transmitted? So that's a great question. The virus that causes COVID-19 is spread mainly from person to person, and mainly between people who are in close contact with one another within about 6 feet. That spread is usually via respiratory droplets that are produced when a person coughs or sneezes. So we cough or sneeze, we make this cloud of respiratory droplets. Those droplets can land on a person if they're within 6 feet of us and transmit the virus, as there's infectious particles often in those secretions. Also, those droplets can land on surfaces. And there's the potential that a person can get COVID-19 by touching a surface or an object that has the virus on it, and then touching their own mouth, their nose, or their eyes. So that's why we talk so much about trying not to touch your face, which is a very human emotion to do, but to try to avoid that if possible. There's also some evidence that the virus may be excreted in stool for people who've been ill. So again, we talked about washing hands really well after changing diapers or cleaning up after a child who's used the toilet. So please be aware of that and know that's an important time to wash your hands as well. Okay. Let me go through a few of the other questions that we got as well. So one question was, how long can the virus live on surfaces? That's a great question. We don't have a full answer to that yet. We think it can be anywhere from hours to even up to a day. So it's really important to be cleaning in our household and other areas, high-touch surfaces with cleaners that we know can kill viruses. So things like our cell phones, doorknobs, our desk and our area around us at work are important to clean because we don't have that information fully elucidated yet about how long the virus can live on surfaces. Okay, we got some questions about if someone in the house gets it, how do we keep everyone else safe? And I think we discussed a few of those, and I'll go over some more detailed kind of advice on that in just a minute as well. All right, we got a lot of questions about traveling, so let me go through some of those. Question was, what's your advice on domestic travel with kids right now? I also got a question about, I'm 4 weeks pregnant. Should I avoid non-essential travel within the U.S. at this time? So let me talk about the person who was pregnant first. We don't really have a ton of information at the moment with published scientific reports about the susceptibility of pregnant women to COVID-19. So I would put pregnant people in the same general kind of category, although we do know that there are other viruses that people who are pregnant can be more at risk for. So certainly it's up to the individual person in talking to their physician. If they're in a higher risk category, then they should really speak to their physician about travel. So right now, the CDC has tons of great information on their website, which again, we have a link to on the Children's National website about travel and who should avoid travel. So certainly individuals who are more at high risk, so older individuals, those with pre-existing conditions or issues with their immune system, should really try to limit travel right now. And certainly we want to limit any travel to areas that the CDC has told us are level 2 or higher. So all that information, again, can be found on the CDC website and is updated very frequently. Right now, there are 5 areas in the world that are that we want to avoid travel to. So those include Italy, Iran, China, South Korea, and Japan. There's also areas in the world where we're seeing, again, things are changing frequently, more sustained community spread of this virus. So I would definitely check the CDC website and talk to your healthcare provider, look at those particular areas that you're traveling to, and to know if you should be limiting travel to those areas as well. I think there's a lot of other information that's important for individuals to collect before they're thinking about domestic travel. So your own work policy. Individual workplaces are placing some restrictions on travel. There's also some policies that may be going into effect in workplaces or have already gone into effect about if you've traveled someplace and then you come back and then we find out that there's a restriction to that area. So you need to keep in mind, if I'm going to need to be under quarantine after I return from this trip, is it worth it to make that trip? So I think that's a really important factor to keep in mind. Again, I would suggest for people who are immunocompromised or high risk that they should definitely limit domestic travel, international travel, and absolutely no travel to the areas that we talked about before. All right, and I can ask more specific questions about that if we get some as we go along later. All right, we got a question about, do masks help? So that's a great question. I think a lot of people have been asking that. So certainly the CDC is recommending that you should wear a face mask if you have COVID-19 or you're taking care of someone with COVID-19 and you've got to go out in public. Again, we'd want people who are symptomatic in general to avoid going out in public, but sometimes people do need to go out in public to even come to get into medical care. So a face mask is certainly recommended at that time. Right now, we really need to think about our communities and globally as well. And the healthcare providers who are on the front lines taking care of individuals who have this illness. And so we're trying to really prevent hoarding or using of a lot of supplies so that they're available so we can take care of our sickest individuals. So if you're otherwise healthy, a face mask is not recommended to wear at this time. Okay. Questions about potential higher risk for pre-existing conditions. So some specific questions that we were asked were, premature babies are at higher risk of viruses such as RSV. Since this is also a respiratory virus, should we assume the same high risk? That's a great question. We don't really have quite enough data right now to know if this is going to be the same as some of those other viruses. Again, we have seen this disease in young children at that time, and like I've talked about, the disease appears to be much milder with all the information we have right now about young children. I think we'll have a lot more data about that as we're testing more individuals, as we know more about what is happening with this disease. So keep looking to the CDC and to Children's National for more information about that. Okay. Are children with previous respiratory concerns or underlying respiratory conditions at an increased risk? Again, yes, we believe so. Certainly that's an increased risk group for adults. And so immunocompromised kids with underlying respiratory conditions, premature kids, as I just mentioned, we are concerned, but we don't have the data about that as of right now. We got a specific question about coronavirus risk level to adolescents receiving immunosuppressive drug infusions such as Remicade. Again, right now, we don't have the data for me to give folks a specific risk level or a percentage. I'd love to be able to do that, but I can't right now for these particular cases. But there's some general advice for immunocompromised kids or people who are at higher risk that I want to kind of go over now. That's been detailed by the CDC that I think those folks should take. And hopefully, as we get more data, we'll have more information to share with everybody. So some of the general advice that we are giving for people who are in these potentially high-risk categories include stocking up on supplies. So what does that mean for stocking up on supplies? So at home, try to have the medications that you or your child needs on hand. Try to have at least a 2-week supply if possible. Also try to have enough household items and groceries on hand so that if you do need to stay at home for an extended period of time, you'll have those supplies available. Take those everyday precautions that we already talked about. They're so important. So clean your hands often. Again, try to avoid high-touch surfaces in public places especially, so elevator buttons, door handles, handrails, shaking hands with people. Those are things to try to avoid for sure. And then cleaning those high-touch surface areas at home is especially important as well. Again, we talked about great cough hygiene, so keeping your cough covered, using a tissue or your elbow to cover your hands when you cough is very important, and using a tissue to touch those high surface areas when you're out in public can also be very important as well. Again, washing your hands after you've been out in public and touching those high surface areas. I know it may seem that we're harping on that quite a lot in the infectious diseases and infection prevention world, but again, it's so important. I can't stress it enough. At home as well, practice routine cleaning of the frequently touched surfaces in your home. So tables, again, doorknobs, light switches, cell phones are huge ones. your desk area if you're doing a lot of work at home. Be sure to be cleaning those often. For immunocompromised patients, we're definitely recommending that people try to avoid crowds, especially in spaces that are more poorly ventilated. That's very important. In any kind of crowded or closed-in setting that has decreased air circulation, we know that the risk of getting a respiratory virus is increased in those settings, especially if there's individuals in the crowd who are sick. I think in general, public health is doing a really great job of trying to get the message out there to people to stay home if you're not feeling well. So hopefully there won't be as many sick individuals, but it does happen. So if you're at high risk, avoiding crowds, avoiding kind of public places, I think is going to be really important. And then again, the CDC is recommending, so for those people that are considered at high risk, to avoid all non-essential travel, including airplane trips, and especially to avoid embarking on any cruise ship or cruise trip. When you do go out in public, if you're one of those high-risk individuals, again, try to keep a little bit of distance from people. We talked about 6 feet as an important radius with this virus, so limit close contact, wash your hands often. And again, if we really are having very sustained transmission of this virus here in our community, then we may encourage people, especially at high risk or all people, to really stay at home. So just be keeping up to date with what's being sent out in terms of messaging from the CDC, from folks here at Children's National, from the DC Department of Health. Those are all really great resources about what we should be doing as the situation changes in our local area. And then, I think it's also really important for people to have a plan for what to do if they do get sick. So have your healthcare provider's number handy, know what you're going to do. You may even want to touch base with your healthcare provider. If you're an immunocompromised individual or you have a child that has special needs that sees one particular service, you may want to touch base with them to have a plan of care for your child ready to go. You may need to be thinking ahead already about who you might be able to ask for help among family members, among friends, in case there is someone in the family who does get ill. So I think those are always important things to do in terms of planning. Plan for yourself as well. If you get sick, who may be able to take care of your child if they're not ill but you're ill and you need someone to take care of them. Always be getting up-to-date information from your workplace as well about what their plan is in terms of a COVID preparedness plan. All right, and then we've got one more question really quickly that I'm going to answer that we had gotten previously, and then we've got some other questions. Sorry, I'm still new to Facebook Live, so it's always not looking at the camera, so I apologize. All right, so let me answer this last one, and then our team is going to, I think, ask some questions that we're going to get to. And I think it sounds like we've gotten lots of questions online as well. So if we're not able to get to them during this segment, I will promise that I will give answers to those, and our team will push those out to everybody. So I promise we will get to those. We really wanted to cover a lot of the basics during this talk. So thanks, guys. All right, so the last question that we had gotten previously are antibiotics effective against COVID-19? So I just want to remind folks that antibiotics are effective only against bacterial infections. Antiviral medications are what we use to treat viral infections. Right now, we don't know of any antiviral medications that are effective for COVID-19, but there are ongoing studies that are being done, especially in areas of the world where they're seeing large numbers of COVID-19, to look at potentials for antivirals, both existing antivirals and potentially new antivirals, to see if they change the course of COVID-19. So definitely more to come on antiviral treatment, but right now our best treatment is both preventive measures, so all the things that I just talked about to prevent yourself from getting ill, and then obviously the great supportive care that we have available at our hospital and others for when people do get sick. So if people need fluids, if they need help with support of their respiratory system, then we can do all of that as well. Okay. All right, so I think we've got some questions now. Now maybe I'll have a sip of water too.
So Tammy wants to know if people are being advised not to travel, why is that if this is considered mild for most people?
Okay, so maybe I should repeat the question in case everyone can't hear it. So someone was asking since the COVID-19 is being considered mild for most people, why do we have some recommendations about not traveling? So I think, as I mentioned, there's recommendations for not traveling, for non-essential travel, especially for people who are at higher risk. Because those people are at increased risk for getting the more severe infection. So we talked again about mild infection in most people, but if you have one of those risk factors, it can be more severe. So that's an important group. Obviously, the areas where we have this circulating very highly in the community, we are not suggesting that we travel to right now, and a lot of that is for mitigating the risk of the infection. So I talked earlier that this is a new virus that we know is spreading easily among person to person, and that individuals don't have immunity to it since it's a novel or new virus. So we know that people are going to get it. Again, the vast majority are going to have mild disease, but when we have a large number of people who have it, even if it's a small percentage that have severe infection, that can be really taxing to our medical system. And so we really want to try to mitigate this, not have everybody present at the same time to the emergency room, not have our hospitals full where we can't provide care for people that really need it. So I think that's a lot of the strategies that are going on now from a public health perspective are kind of about mitigating the disease in terms of kind of trying to spread it out over time so we're not inundated with a ton of people who are very ill all at once. So I hope that answers that question.
Should families keep their children's national appointments?
Okay, that's a great question. So the question is, should families keep their children's national appointment? So right now we would recommend that if your child is ill with a respiratory illness, you may want to touch base with the folks first to let them, to ask about if you need to keep that appointment, if it's a routine appointment that potentially could be put off. We are doing a really great job at Children's National with screening. So if people come in who are sick and they'll kind of be screened to a different area, and certainly if they have risk factors. And certainly if you have an emergency situation, then we do want you to come to Children's National so we can take care of your child in case of emergency. Children's is doing a really great job with coming up with resources for hopefully in the next coming weeks for telemedicine for appointments, for us to try to do that way if needed. But for right now, if your child is otherwise well, and we would definitely say to come to your appointment at Children's National. If your child is ill, then please maybe check base with that clinic or your provider first before coming in.
Can we talk about the immunocompromised children and those recommendations and tips just briefly for some of the people that just joined?
Sure. Yeah. If you want me to go back over those recommendations, absolutely. Okay. So things that we really talked about for, again, people at higher risk or immunocompromised kids. So we're going to go over those tips again because I think some people recently joined and wanted us to review those. So things we talked about is having a medication supply. So if your child or yourself is on chronic medication, having a supply at home. So in case you do need to stay at home for a prolonged period, you've got your medications ready at home. And then having enough kind of household supplies as well in case you need to stay at home for an extended period of time. Again, taking everyday precautions to keep space between yourself and others, so social distancing. We are all very social people, and I think that's great, but we do really need to try to avoid public places if you're somebody who is at high risk. We talked about hand washing, so the importance of really, really good hand washing, of being very careful with high-touch surfaces in public places, so elevator buttons, again, door handles, handrails, those are essential. Avoiding touching your face, your nose, your eyes in public. cleaning within your own home, especially high touch surface areas like cell phones, avoiding crowds in general, especially in poorly ventilated spaces, and definitely for immunocompromised or high-risk individuals to avoid all non-essential travel, including trips on planes and cruise ships. And again, I really would refer you guys all to the CDC, which has this advice that I've kind of gone over, really written out for everybody with a tab that's specifically for people who are at high risk. And what the strategies should be for those individuals. Okay, I think we've just got one more question, or time for one more question. But again, we will get to everybody's questions in the comments later, I promise. And I do want to just remind everybody of those resources, again, that I've been talking about. I'm really stressing them because there's a lot of information out there on the internet that may not be appropriate. And so the CDC, again, a great resource, the WHO, Children's National. Oh, one thing I did not talk about, but I think is super important, is the AAP. The American Academy of Pediatrics has a lot of great information about COVID-19 and also has some great information for how to talk to your child about COVID-19 in general, because I think that's a question that's come up quite a lot as well. All right, so our last question.
Should soap be antibacterial or not?
Oh, should soap be antibacterial or not? Okay, that's a great question. So, for soap, we like people, the most important thing with washing your hands with soap and water is to be using soap, washing your hands, and that contact, that 20 seconds of rubbing with soap and water. So those are the most important things. If the soap is antibacterial, that's great, but if it's not antibacterial, as long as you're doing a great job washing your hands and for 20 seconds, that's also fine. So it's really that process of washing your hands well, getting into all the nooks and crannies, and really washing well for 20 seconds. That's most important. Again, really great videos to show families and to show your kids are available online about how to wash hands well, with different songs that we can sing that last 20 seconds for hand washing. So, all right. Thank you all so much for joining us today for this Facebook Live presentation. So thank you all for your great questions as well. And I will definitely answer the ones that we haven't gotten a chance to get to. And again, please don't forget to go to all those resources that we talked about. Thanks all.